January is Cervical Cancer Awareness Month. The problem with cervical cancer, though, it doesn't have any obvious symptoms.
Yeah, but as CBS 21's Lara Greenberg explains in this week's Doc Talk, it is preventable.
Ladies, all it takes is one test done regularly to keep cervical cancer away, a Pap test. Those visits to the OBGYN are never fun, but they are crucial.
The following segment is sponsored by Holy Spirit, a Geisinger affiliate.
It's an appointment that could save your life.
A provider will often do a Pap test, which is looking for changes in the cells of your cervix.
A Pap test. It tends to be pretty uncomfortable.
During the Pap test, a small tool with a brush on the end is used to sample those cells.
And most times the test results come back normal. But if they don't, it could mean cervical cancer.
Cervical cancer is abnormal cells on the cervix that could lead to cancer and may need further treatment.
Which is why getting a Pap test is so important. Women should start getting them when they turn 21 or when they become sexually active, whichever comes first. The test should be done every 3 years, but
that may be altered based on your individual needs, based on your past medical history, family history, if you have a high-risk history of abnormal Paps in the past or not.
If the Pap test comes back abnormal, your doctor will likely need to do more testing.
Additional testing may be recommended, such as colposcopy. That's where the cervix is looked at under a microscope.
Or a doctor may do tissue sampling, also called a cervical biopsy. If it's not cancer, the results could show you have HPV,
which is the virus that could potentially lead to cervical cancer, is very common.
All the more reason to get tested. Again, doctors say there are very few, if any, symptoms otherwise, so Pap tests really are the best way to get tested for HPV or cervical cancer. Talk to your doctor about your family history and how often you should have them done. With this week's Doc Talk, I'm Lara Greenberg, CBS 21.